L'appello a non vaccinarsi è un appello a morire, sostanzialmente. Non ti vaccini, ti ammali, muori.
I want to emphasize that the vaccines provide very strong protection from severe illness from COVID-19. I know there's a lot of confusion and misinformation, but the world's leading scientists confirm that if you are fully vaccinated, your risk of severe illness from COVID-19 is very low.
Well, as the COVID-19 vaccine rollout forges on, some people are still vaccine hesitant or anti-vaccination, despite the overwhelming evidence that it's safe and effective.
Safe, effective COVID-19 vaccines will offer protection against the virus, helping to prevent death and serious illness.
Australia's advertising has largely consisted of health professionals encouraging people to get vaccinated. Not every country has taken the same approach. Let's take a look at how a few other campaigns have worked around the world.
We're going to have the vaccine now, Elton, so just kind of pretend that you're having the vaccine from a nurse.
Oh!
What was that, Elton?
That was me, acting.
OK, let's cut there.
Thank you. Hello, my name is Michael Caine. I've just had a vaccine for COVID. It didn't hurt. Not many people know that.
We're overfighting and we're ready to win. Watch out.
Because you know what this is? It's the metaphorical door to freedom.
Something love. Guess who's back? It's Uncle Bob.
And me, Rosie.
Everybody, it's time to vaccinate. Faster, Lola. No time to waste.
But you are easy, confirm say.
Yeah, Rosie, come on, be brave.
People aged 50 and over can now be vaccinated. It's voluntary, free, and the best way to protect you and your community. It's free, simple, and the best way to protect ourselves and our community from COVID-19.
And the quicker we get vaccinated, the quicker we can live more freely. If the vaccines are in Australia, I want New South Wales to get its share so we can get those jabs in arms, because that will help us not only in keeping people out of hospital, but also slowing the spread and having our chance at freedom.
If you get COVID-19, you will not have severe illness from the COVID-19 virus, and your chances of dying from the virus will be very low to non-existent.
A man in his 80s died at an Nepean hospital facility. He was vaccinated. Sadly, there's been 2 deaths from people with COVID reported yesterday. A woman in her 80s from Western Sydney who died at Ryde Hospital. She'd received 1 dose of COVID vaccine. And a man in his 50s from Western Sydney who died at Concord Hospital. He had received 1 dose of COVID vaccine. A man in his 90s from southwestern Sydney who died at Liverpool Hospital. He was vaccinated.
In terms of the deaths, sadly, we have been notified of 5 people who have passed away. A man in his 90s from southeastern Sydney died at St George Hospital, and he was a resident of the St George Aged Care Facility in Bexley and acquired his infection there. He was fully vaccinated. There was a woman in her 80s from northern Sydney who died at Ryde Hospital. She had received 1 dose of a COVID vaccine, but also...
We remind everybody of the importance of vaccination where there is strong evidence of preventing serious disease and preventing death. I'd like to give you a few more details about some of the individuals who passed away. There was a woman in her 60s from southwestern Sydney who died at home and had received 1 dose of vaccination. We report today the deaths of 9 people who had COVID-19. They are a man in his 60s from Western Sydney, a man in his 70s from southeastern Sydney, a woman in her 40s from southwestern Sydney, a man in his 70s from Sydney's southern suburbs, a woman in her 50s from Central Coast, a man in his 60s from Western Sydney, a woman in her 80s, also from Western Sydney, a man in his 30s from Nepean Blue Mountains, and a man in his 50s from southwestern Sydney. 3 were fully vaccinated, 3 had had 1 dose of a COVID vaccine, and 3 were unvaccinated.
Your chances of dying from the virus will be very low to non-existent.